Um, Mr. Peter Hill is a 19-year-old student, university student who is currently an inpatient on your ward and admitted a few days with bizarre behavior, auditory hallucinations, odd beliefs of lizards taking over the ward for more than 6 weeks. Blood and urine tests are normal. His mother is angry from the nurses that he's been diagnosed as having schizophrenia. Miss Linda Hill wants to seek clarification of her son's diagnosis, address her concerns, and allay her anxiety.
Okay, both of you ready?
Yes.
Okay, enter the station, do your task.
Hello, Mrs. Hill. I'm Dr. Panwala from Mental Health Unit.
Yes, doctor, please just could you just hold on with your introductions? I'm not really interested in at the moment. So I'm here because you and your staff have been saying I'm a bad mother, and it's really unfortunate that in a place of safety, this is what I get.
I'm so sorry, Mrs. Hill, but what made you think?
Well, number one, I don't think you're sorry, because if you did, I wouldn't been hearing all this nurse what do you call it, gossip from nurses on the corridor, and they were laughing about it that my son has schizophrenia. And I've gone home, I've researched it on the internet, and it says because I was a bad mother, that's why he has schizophrenia.
I'm so sorry, Mrs. Hill, that you heard from the nurses. They shouldn't have done this. And this is very unprofessional of them. And bad mother is very old theory. Bad mothering is not, schizophrenia is not because of bad mother.
So you say it's an old theory, so it's part of the reasons then. If
This is
it was
very
it true?
old theory. Previously, they used to believe, but nowadays, there are some new researches, and bad mother is not at all responsible for your son's condition.
If I'm not responsible, then who is responsible for my son having schizophrenia?
We don't know the exact reason, but there are multiple. There are some researches, and there could be different reason for that. One of them is it can run in families.
Right.
Can I just check, is there anyone in your family who has any mental health condition?
Is that the discussion? Is that what you want to add fuel to fire? Then the nurses will have more ammunition to talk on the corridors about what's going on in the family. We are a generation of bad mothers causing schizophrenia for our children.
I didn't mean it, Mrs. Hill. I'm so sorry if I made you feel that way. But I'm just telling you the different reasons. And we don't know exactly the reason in your son's case, Mr. Peter's case. There are some reason of schizophrenia. One of them is it could be because of substances like cannabis.
Yeah, I know he's recently just been in university, isn't it? So why couldn't it be cannabis or him taking alcohol or something? Why does it
Yes.
have to be, related to me? So you think it's cannabis then that causes schizophrenia?
Mrs. Hill, still we don't know the reason, but cannabis and alcohol could be one of the reason.
Right, I see. So it's either is in from the family or it's cannabis and alcohol.
So there are multiple reasons, and we don't know, we can't pinpoint the exact reason.
I see.
There could be mixture of mixture of reasons, like there could be some chemical imbalance inside the brain,
Mm-hmm.
some social stressors, like in your son's case, he could be under immense pressure from his friends.
Right, I see.
This could be just possibility.
So that's a big worry because he's in university, he has to socialize somehow. And if he's getting pressure from his friends, then what kind of future are we looking forward to? He has to
So
be in school.
yes, I understand that he is going to university, but we have to be careful because
Mm,
his friends, we should be careful because he can be under pressure to take substances, so he should stay away from those kind of friends.
I see. So do you think that, what are his chances of even completing university? Do you think I should take him out? Does he have any chances at all?
So first of all, since he is in hospital and we have good opportunity to treat him, we have started him on some medic. Since he is experiencing some odd beliefs and he's seeing lizards, right?
Yes,
So at the moment, we think that he is having psychosis, and I believe this is first time that he is experiencing this.
yes, this has never happened before. I mean, it's just puzzling, really.
Yeah, and I understand from the notes that since last 6 weeks he has been experiencing these symptoms, right?
Yes.
Yes.
So
So
can
so
he,
if
what the chances? I mean, I am worried about his future. He's an intelligent boy and he's studying engineering. What are his chances of being an engineer? I wanted him to, construct fantastic buildings in London. What are the chances that will ever happen?
so we don't like, this is a very difficult question for me to answer at this moment, because since we have started him on medication, and if he will take medications regularly, then there are good chances that he can proceed and with his university studies. And we will also put him in touch with our early intervention services, which will follow him for up to 2 years, because
Hmm,
many a times what happen, patients stop taking medication.
I see.
So for 2 years they will make sure that he takes medication.
Okay, I
And
see.
we don't know exactly, because some patients can have these symptoms for long period of time, and some can get better and they don't have any symptoms for rest of their life.
1 minute.
Right, I see. So with regards to these nurses that were, chatting about my son on the corridors, what's going to happen?
So I'm sorry for that, and if you want, we can, if you want to take it further, I can talk to the ward manager. And if you want to complain, then I will also help you with our license services.
Yes, I would like to complain.
So I will guide you with that procedure.
Right. Okay. Thank you.
Do you have any other question for me?
No, I mean, no. I wanted, you've told me about his diagnosis, so that's fine.
Okay. Thank you so much, Mrs. Hill, for talking to me.
Yeah.
Okay. First of all, I think this is not the etiology of schizophrenia station, but that's it. That's fine anyway if you've done this. Yeah, the etiology is another one.
We
I
were
think
looking for a station, but we didn't find etiology of
yeah,
schizophrenia.
it's
Is
a
there any?
Muslim patient, Mrs. Hussain, who is talking about
Oh, that is
not
genetic of schizophrenia.
genetics or etiology. I think it's both the same. Yeah, but that's fine.
Oh.
Even this station, this is also okay station. It does come. That's fine. That's no problem. Okay. Now let's start to the feedback. Okay. So now remember this: if any station you see an angry mother, remember lot is there in your communication. Okay. So, for example, somebody comes, okay? Now, every time I say this, whenever I teach, that always think practically, okay? Don't think, forget it, it's cask. Think about what would you do in a practical situation. You are a doctor or a consultant or whatever, okay? And some patient, okay, comes or patient's mother comes and says, your nurses did this. You don't know anything. Would you say that it is very unprofessional of them to do that? When you've not witnessed it, do you think it is professional on your aspect to say that it is unprofessional for the nursing team? You don't know. You don't know. You were not there, right?
Mm.
So always say, "I'm sorry that uh, For example, what is the concern? To be honest, I couldn't understand that. Like, if I were in your position, I'll say that she came and said, "Okay, I heard the nurses talk about my son having schizophrenia." What's the Is it, I think, overlapping somewhere? Okay. So always check, okay, that, like try to understand what is the main concern the person is having. Okay. Is she worried that the son is got schizophrenia? Is that what is the concern? Or is it the concern that the nurses were talking? Okay. I know one student went and said, I'm sorry that it came from the nurses, and they had a severe fail. Okay. You can't put down the nurses. It looked as if he's saying that he shouldn't have come from the nurses. Just say that, okay, I'm really sorry. Okay. I'm really sorry that, you felt this way. Okay. Can I check? Can I get a better understanding of what is actually troubling you? Okay. If they say, oh, the nurses, they were talking about my son having schizophrenia. Okay. So in the corridor, then you can just check. I'm sorry, I was not there to witness this. What I can do is I can have a word with the nursing team and look into what actually happened. Is that all right? Okay. And then say, okay, so is there anything else worrying you? Okay. Oh, my son has schizophrenia. So basically, the concern is the stigma that the son has got the diagnosis of schizophrenia. Okay. Now, here you can say that, okay, is it the diagnosis which is bothering you? Okay. And then go into the diagnosis. She'll say, yeah. And, I feel as if I'm the bad mother. Now, you said the bad mother is the old theory. And the actor caught on that. And she said that, okay, so it did exist before. And you said, no, we don't believe it anymore. So you were like confused at that time. That bad mothering and all, forget about it. Okay. Whether it was old theory, what happened 10,000 years ago, you don't have to say that. Just say that, okay, I'm sorry that you feel this way, but let me reassure you, it has nothing to do with you being a bad mother. Okay. And though you said there are various reasons, but you never actually elaborated the reasons. Okay. Kept going on and off, like about being bad mother, then something else, then cannabis. It was not very clear. Alcohol doesn't cause schizophrenia, does it?
Alcohol induced psychotic symptoms.
Is it alcohol induced psychosis or is it
Mm.
alcoholic hallucinosis?
Yes, hallucinosis.
Yeah. So you can say illicit drugs. Now, when you say, okay, there are various other reasons, okay, or there are many factors, nobody can pinpoint exact reason why somebody would have schizophrenia. Would you like to know about that? Give them an option and then say, okay, one of the reasons is, it can be some chemical imbalance in the brain. Okay. The other reason can be at times, it tends to run in the families. They say there are some genes have got some role to play. Okay. At times, if a person misuses a lot of cannabis, uses some illicit drugs, the person can be predisposed to having schizophrenia later. Can we check, about whatever the person's name is? Do you think he may have got, may have been using some illicit drugs, some cannabis? I'm asking you a very sensitive question, but do you think that's the case? Oh, yeah, doctor, but don't you think all teenagers do that? It's just fresh into the uni. You can say, yes, you are right, but then at times some people are more sensitive to others. And, one person can use cannabis, not become psychotic. The other person can use drugs or cannabis and then become psychotic. So, it all depends. Like at times some people are more predisposed to develop psychotic symptoms. So if he's been using that, I would say, he might need some support to stop using cannabis if he has been using it on a regular basis. Okay. Then very important thing about, she asked you the question, what are the chances of him getting to uni? Okay. You did not answer that. You start talking about, can I check if this is he's got psychosis? He was seeing lizards. Is this the first time? Now, when you are talking about first episode psychosis, okay, are you trying to say this person has got first episode psychosis? Remember, first episode psychosis is a different diagnosis. It's not schizophrenia. Okay. You either check the person initially and say he's not got an established diagnosis of schizophrenia. I would say it's first episode psychosis. Why did you start talking about him having first episode psychosis in the middle of the station? I couldn't understand why you changed. She's asking you a simple question. Okay, he's got a diagnosis of schizophrenia. What are the chances? So, what is the question? The question is about prognosis, isn't it? So, talk about the one third rule. So, say that, okay, now check that again. The evidence suggests that one third people who have diagnosis of schizophrenia remain well on treatment. Okay. One third may not reach treatment and can still remain well later into the life. One third, despite treatment, may not, may show some symptoms throughout their life. At the moment, it's very early for me to comment which direction he'll take, okay, because it's too early into his illness. We are very hopeful, okay, that he should show a good response if, he chooses to remain compliant or he remains compliant with the medication. Okay. The whole thing about him having early intervention psychosis, him having medication for 2 years, it's just going off the track. This question is very simple. What is the chances of my son going to uni? They also ask, what is the chances my son is going to get married? Again, you can say that people with schizophrenia are known to get married, have children, and have good lives. Okay. Evidence suggests that even people with schizophrenia, they are, some people are on medication, they remain well. Some people may not need medication after a certain while. Okay. And even people with schizophrenia get married, they have children, they go on to have good families or happy families. Okay. At the moment, it's too early. Okay. And if there is ongoing cannabis use, you can say that, okay, do you think he would agree to some support? Because mother can't force, you can't force. Do you think he would agree to some support with cannabis? Okay. We can make a referral to drug and alcohol services. Okay. Now, yeah, that is why I'm saying, because towards the end also she kept talking about the nurses were chatting. Okay. And it was not clear. And then you straight away went, okay, do you want to make a complaint? Yeah. If she says, yeah, I want to make a complaint, you can say patient advisory liaison system. I can guide you through that. But then you should not make your own judgment about what the patient's family member is saying on your own team without even knowing what has happened. Okay. Is it clear? So sorry, somebody's got the hand up.
Hi, I just had a doubt. Thank you.
Yeah.
I actually got this station for last January cask.
Mm-hmm.
I failed this station, so I just wanted some tips, especially because I felt some things were a bit difficult to handle.
Sure,
In the
sure.
real life station, the mum was very angry,
Yeah, yeah.
and she was standing all the time.
Okay.
So I was
Okay.
a bit unsure how to,
Yeah, yeah.
whether I can talk in the same position or I should encourage her to sit and talk, because it doesn't seem nice that she's standing and we are having these in-depth conversations about schizophrenia. So I was a bit
You should
thrown.
be able to sit. At times, what happens is the actor will mirror what you are doing. So you should sit and offer them a seat. If the person is standing and jumping around, you don't need to jump around and stand with the patient. You just sit there. I mean, sorry, with the actor.
Okay.
Offer them a seat. Say that let's have a discussion about. I can see you are very anxious. Give me some time, or let's utilize this time which we have in a fruitful manner. And I can
Mhm.
only do that if you can have a seat and let's have a discussion about what's actually bothering you. But
Okay.
you
So
should,
yeah, thank you. So I was a bit unsure because she continued standing. I didn't want to come across as rude by sitting down, and so I would just like encourage her to sit, and I would sit down, and then maybe she would have sat down later.
absolutely, absolutely. Imagine if some actor is anxious and you are also standing. So you're not actually when you sit down, what message you are giving to the actor, that okay,
Let's sit
let's
down.
utilize this time. Okay,
Yeah.
there's no point in getting heightened. There's no point in getting anxious. We need to sit down and have a conversation.
Okay, yeah, yeah, that is helpful. And the same way, it was about being a bad mother. So I tried diverting her, but I'm not sure I was very good. So she was latched on to the idea. So I didn't know how to kind of change the conversation. And I kind of fell for it as well in some ways. I started reassuring her that she's not a bad mother. And I think that was a bit unwise on my part.
No, no, no. You have to. So you can just say, well, if she says, well, what did she say exactly?
She was like, she initially said the same, that the nurses said this, and then I reassured her that I said things like, yeah, I wasn't there, I don't know what happened, but I can have a chat with the team and look into the incident. And
Remember,
I
don't say incident. It's not an incident.
okay.
Yeah.
And I did offer the pulse as well. So should we not offer that immediately, or
Why should you?
okay? So unless she
You.
specifically asked for that.
No, if she's bothered about the nurses having a conversation in the corridor, you can just say, okay, I'm sorry, I was not there to witness this. What I can do is I can offer, I can have a chat with the nursing team and see
Mm-hmm.
what actually happened on that day. Does that reassure you? Is that
Yeah.
okay? Yeah, you don't have to be overly submissive and just because a person is angry, you are like, oh, just go and come and kill me. No, you don't have to do that.
Mm. And at some level, she started saying that maybe I'm also blaming her, that she's a bad mother, and I was like, no, I never
That's what I'm
meant
saying.
that.
If you say this was whole theory, you don't have to say that. So many theories existed in the past. You don't have to say. So
Huh.
what did she say? Am I a bad mother? Like, can you tell me what exactly she asked?
So first she said the nurses said this, so I kind of reassured
What
her
did
that
the nurses say? That she's a bad mother.
yeah, yeah.
She said that nurses were saying that she's a bad mother, or did the nurses were talking about the causes
Uh,
of schizophrenia? What was?
no,
I
the
don't think she'll
nurses
say that.
were chatting about her son having schizophrenia, and
Hmm.
I think she mentioned something like she has read somewhere, if my memory
Exactly.
is
She
right.
can't say
Yeah,
that the nurses were saying that she was a bad mother. That's ridiculous. She won't say
yeah,
that.
yeah,
So if
and
she's read somewhere, you can say
yeah.
that, okay, I understand, okay, that you've read this somewhere,
Mm,
okay,
mm,
and but let me reassure you, this is not the case. That
mm,
has
mm,
nothing to do with you being a bad mother. Would you like to know
mm.
what is the causes why a person can be predisposed to develop schizophrenia? I would just say that
Yeah, okay, yeah.
there can be loads of utter rubbish written on the internet. That's
Mm,
fine. You just have to
mm.
reassure that that's not the case.
Okay, all right. And I didn't actually catch the exact percentages which you said, like one third get better, is it?
Yeah, I mean, that's what I'm saying. Just have a look into it. These
Mm,
theories keep changing. But
mm,
what I know is one third they take treatment and they remain well. One
mm.
third, despite treatment, they can have some symptoms ongoing. And one third, they might not treat treatment. Just check this prognostic thing because it keeps changing. Every few years, it keeps changing.
Okay, all
Yeah,
right.
just have a
Okay.
look into that. If you don't know anything, just say that, okay.
Mm.
Uh, like what is the question? Is it about the uni question?
Yeah, she did ask me something like that. So I kind of said, yeah, many people with treatment, they do get better or remain stable and go on to have successful lives. Some do not, but we will have to see how it kind of pans out in the next few years, something like that.
Yeah, so even if suppose I don't know, I don't remember the exact the exact evidence or the exact
Mm.
percentage. I'll just say it's not at the top of my head at the moment. But what
Sure.
I know is with
Yeah.
treatment, people do go on. People with schizophrenia go on to have very successful lives, successful careers. They get married, they go to uni, they have children, and yeah, because treatment has advanced over a period. I'll
Yeah.
just and I will still not be wrong because I'm not giving wrong information. What is bad is giving wrong information. So that's why I'm
Yeah.
saying check this. What I know is this does exist one third rule, but still check it. It keeps
Okay.
changing.
Sure. Okay. Thank you so
Okay.
Can I just ask one question?
Yeah.
This is 6 weeks duration. So is it for schizophrenia or first episode psychosis? I'm
If it
still.
says if your station says he's got a diagnosis of schizophrenia, it is schizophrenia. Schizophrenia diagnosis, you just need 1 month.
According to ICD 10, 11, yeah. Otherwise, according
ICD-11
to
doesn't
DSM,
talk about 1 month.
yeah, and DSM says 6 months.
ICD-11 talks about 1 month. Yeah.
ICD 11, I'm not sure, but ICD 10,
I don't
1 month.
think ICD-11 talks about 1 month. It is an ICD-10. But whatever, even if you're quoting ICD-10, first of all, forget about all this ICD-10. If it is there in your task says schizophrenia, that's what I'm saying. You got very confused. You start talking about first episode psychosis, early intervention team. Your station just went somewhere else. Okay, either it says that, okay, you are convinced, it says that, okay, the nurses were saying he's got schizophrenia, but he's got a diagnosis of first episode psychosis. Then it's a different thing. Read what is there in your task.
It is not given in tasks. It is not given
It
the
is not
patient is
given,
having
then
schizophrenia.
Don't make up your own that he's got first episode psychosis. Okay.
Okay.
All right. Okay.
Thank-
Bye bye. I'll see you guys next week. Bye.